Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, the host of Straight Outta Health IT. Welcome back to another amazing show that we're going to have today. Today, we're actually going to be discussing a topic that I had the opportunity most recently to write a blog on. And the title of that blog was Closing the Social Determinant of Health Gaps with AI, Machine Learning, and Data Analysis. Who better to talk about this in greater detail than the industry expert that we'll be talking to today? So before I introduce her, just want to share a little bit of insight on this concept of social determinants for those who may not be all that familiar with it. According to the Centers for Disease Control and Prevention, CDC, social determinants of health are the non-medical factors that influence health outcomes. The factors include conditions in which people are born, grow, work, live, and age. They are a wider set of forces and systems that shape the conditions of daily life as well, such as economic policies and systems, development agendas, social norms, social policies, racism, climate change, and political systems. In recent years, healthcare organizations have begun to examine social and behavioral health data influencing health equity. In fact, the CDC recently announced the release of new diagnosis codes for 2023 with a focus on social determinants of health that will become effective as of April of this year. Included is a diagnosis code option that further captures social determinant of health problems related to education and literacy. So to delve into this subject in greater detail, I want to, again, introduce to you my guest for today and subject matter expert, Rachini Moosavi. Rachini Moosavi currently serves as Vice President of Enterprise Analytics at UNC Health. She is passionate about empowering people, delivering value, and improving lives. Over her nearly 20 years career in healthcare, Rachini has served in analytics, clinical operations, process improvement, and leadership roles. As a recent graduate of the Carnegie Mellon University SDOH certificate program, Rachini continues to champion and lead data and analytics enablement programs within the Enterprise Analytics and Sciences team and across the analytics community at UNC Health, ensuring that healthcare transformation continues to be catalyzed by insights. So join me today in welcoming Rachini to the program. Welcome.
Thank you, Christopher. I'm happy to be here today.
We are so excited to have you on the show today, and I look forward to delving into this topic in greater detail. But before we start, I always ask my guests to really fill in the blanks behind the bio that I always read. That there's a story behind everything that you've done. How did you get into this career? What drove you here? What you're passionate about? So if you would just take a few minutes, Rachini, and just share with the audience your story. What got you into health informatics and why are you so passionate about it? And tell me a little bit about, and we'll delve into this a little bit more in the conversation, but tell me a little bit about some of the things you're focused on right now.
Yeah, I will start by saying that my career found me. I did not know when I started my career journey that I would end up here, but I am so happy that I did. So I'm going to take you back a little bit in time. I started off, I am Carolina bred. So UNC Chapel Hill is my undergraduate and graduate degree home. And I did, for both of them, I did a bachelor's in science of public health and a master's of health administration. So I've always known I wanted to be in healthcare. I've done some dabbling, clinical, very minimal. So I will say that is the smallest part of it. But I quickly learned that I really took to the business side of healthcare. Probably more so than the clinical. And I felt like that's where I can make my impact.
Sure.
When I worked in consulting and got to have that fun experience of living about 2 lifetimes in every year.
Exactly.
And seeing how patient flow worked at multiple hospitals. And then I waited at UNC Health, and I started off as an analyst, worked my way up. And that's where I really found my passion for data. So I started on the revenue cycle side and grew all the way up to starting our data governance office for the healthcare system. And now I have the privilege and honor of working as a vice president for enterprise analytics and leading and working beside some of the best minds there are in data and analytics, not just on my own team, but throughout the entire analytics community at UNC Health.
That's great. Congratulations on all your success. And it sounds like you've really been at the forefront of driving the value proposition around data within your organization, having launched some of the programs there. So let's jump into the topic and get your thoughts and insights on it. I want to start with kind of the impact of social determinants of health on health equity. There's been an increasing body of evidence that supports how the socioeconomic factors every day and the life choices people make directly impact people's well-being and overall health. And some of those social determinants include including your zip code you live in, your education level, access to food, physical safety, quality of childcare, nutritional choices, employment, housing, and reliable transportation, just to name a few. Now, healthcare organizations' policies are often determined by the regulators themselves, which largely influence and interpret social determinants of health, and understanding that impact of that data can help providers plan and address institutional biases associated with the delivery of healthcare. And they can also prevent poor decisions by the healthcare community based on that limited information that's generally collected through their internal gathering methods like their EHR. I think the goal of collecting this data as we go forward should be placed on providing an additional lens and perspective on the various environmental factors that affect a patient's overall health. And those factors offer really a more complete picture on where the institution is investing its resources and services and education and support and overall accountability, quite honestly, for making sure we provide services that increase and improve the lives of the patients that we serve. I'm just curious from your perspective, could you share with us what UNC Health is doing to capture this type of data outside the four walls of the hospital around its patient populations? And what types of tools and technologies are you investing in to aggregate that information?
Yeah, I think this is such a critical topic. And at UNC Health, we have multiple groups that this is at the forefront of some of their needs, but also some of their greatest challenges. So everything you said about social determinants of health and how that factors into how we identify how best to serve our individual patients is a really big piece to how you deliver excellent healthcare.
Exactly.
Groups like our Health Alliance, a team that their sole purpose is to try and ensure that they get to those who are in greatest need and understand how to best serve them. They really acquire information on social determinants of health. Our equity and inclusion group as well. I'm a member of our system equity and inclusion work group. And it's such a critical topic that we discuss all the time. But I think you touched on it. How do you get at that data?
Yeah. How do you guys do it?
Yeah. So I will tell you it's an evolving conversation. Okay. I would challenge us to say in healthcare, this is not something that we've done well historically.
Exactly.
It's something that we are at the forefront of doing better at, and that the technology per se, like our EHRs, for example, haven't often kept pace with the kind of information that you need to have in order to really build in social determinants of health into things like your AI and your data policies and other
things. And then some of the inherent biases that the AI may present as well, too.
Absolutely. Absolutely. But the thing about anything like this, like social determinants of health, is you're getting information from a person. Right. And somebody is typically asking that. So there's a lot of workflow that goes into that. Even if the technology is there, your technology is only as good as the processes you have, the people you have, and the data quality that monitors all of that. So those are all things that we have to continue to grow our programs on to gather more of that information. There are some aspects of social determinants that we're doing pretty good on, and there's others that we have a long way to go to do better. And then there are also the multiple places where you can put information. How do you ensure that there is a streamlined path that we can now take that information in a way that more people can use it for the benefit of our patients and the community?
And how do you reach those patients where they're at in their community as well, too, so that you can get that accurate, complete information based on those social factors that they're dealing with as well?
Absolutely.
Yeah. And I do the fact that you pointed out people, process, and technology as well, too, because it's not technology is not just the silver bullet. It's not going to solve all the problems, right? You have to understand the people factor of that. You have to get people comfortable in wanting to share this type of information. You have to have the processes in place that accurately capture that information. And then you can leverage the technology as a tool to help you gather, aggregate, and draw insights from that information that you are collecting from those individuals. But it does start with us as human beings being able to connect with those individuals and create an environment where they feel comfortable in sharing very personal information about their lives.
Absolutely. But I also love that you touched on things as simple as zip code, right? There's so much information, the vast amount of data that's out there that are not just collected by us in the health system that we can leverage. There's environmental data that we can bring in and how that has an impact on health outcomes. There's food deserts and whether our patients are living in one of those areas that's considered such. So there's a lot we're trying to do within the research and analytics side of healthcare to try and bring in some of those external data sets, things that we don't generate ourselves, into some of our analyses and use them in the right ways to be able to serve our patients.
That's right. And there lies the challenge and the opportunity.
Exactly.
So let's delve into this a little more deeper. Access to quality of care is another challenge many patients that requires a deeper assessment of all those extenuating factors related to social determinants of health. For example, many uninsured and underinsured individuals can't afford the cost of the quality of care because health plans are too expensive, or they live in communities that don't offer qualified health care providers. Many of those individuals end up in the hospital ED, in emergent care facilities for their basic primary care, which is a very expensive part of the care model as well, too. And they don't always get the best care as possible as well, too, because it is based on really episodic care versus ongoing quality care and having a primary care physician who can manage their chronic diseases if they're dealing with some of those things or other social determinants. It's also a challenge that much of the healthcare system has to, quite honestly, absorb some of that costs, right? Especially those who present themselves in the ED who are underinsured, or what we call self-pay or no pay in some cases as well too. And that presents a challenge as well. Now, I was reading a document from the Wellesley Institute, and it said, the goal is to ensure equitable access to high quality healthcare regardless of social positions. Two prolonged strategies are required. First of all, the institution must build health equity in all planning and delivery. This doesn't mean all programs are about equity. However, it does mean they should all take equity into account in planning their services and outreach. The second thing it pointed out was institutions must also invest in targeted resources and programs that specifically address disadvantaged populations or key access barriers. Specifically, they must pursue opportunities for investments and interventions that will have the highest impact on reducing health disparities or enhancing opportunities for good health of the most vulnerable. To pursue any of these course of actions, holistically, timely, and accurate resources of data will be required. So I'll put that back on you to maybe comment or respond. Specifically, can you share with us what UNC Health is doing and partnering with the local community and other institutions to address these or implement these types of strategies to help close the health equity gap?
Yeah, so I can't speak to all the different program pieces because I sat on the data side of the house.
Sure.
But yeah, I think that is such a great article that you were able to reference, right? Because what you're really highlighting is where our equity and inclusion department is putting a lot of their focus. And I think you'd be hard pressed to find a health system nowadays that doesn't have an equity and inclusion department.
Exactly.
Equity and inclusion is part patient. And how do we ensure that they are getting the best care that they could possibly get at our institutions? And it's part workforce.
Right.
How do we make sure that our workforce is representative of the communities that we're serving? Our equity and inclusion department is doing a lot to embrace data. We've built out some dashboards alongside them and partnered to look at how do we take all of our quality metrics and bring an angle of equity and inclusion into the understanding of those quality outcomes?
Sure.
And I think a lot of hospitals similarly are choosing what are the key areas that they want to start focusing on? Where are the clinical conditions where they're seeing maybe some disparities in care? And how do we build out our programs around it to ensure that we are putting the right attention to that quality of care? And that's how our organization is using data to shed light on it, which is often step one, but then also build out programs. I would also be remiss to say that we've got a wonderful research community around us that are doing comparable things. They are working not just with UNC Health, but multiple community groups running studies and looking at how equity and inclusion has a big impact on how we deliver care in just the care delivery of it. And we learn from that. We collaborate with our researchers often. And if we can operationalize some of the great work that they've proven to be true, then we work side by side and make some of those changes happen.
No, that's great. I think you guys are really fortunate that you're in a part of the country that has so many academic and research facilities around it and at your disposal, and you can take advantage of that. I'm also curious, though, and if you're comfortable in sharing, as you've done some of this research, because you pointed out that there's an external lens of the social determinants of health we look at, but there's also, we have to look internally to see, do we also have our own inherent biases as well in how we treat certain populations? And I'm just curious, as you've done research and analysis, were there some internal things that you recognized in your organization that needed to be challenged in terms of how you are delivering care for certain populations?
Yeah, so I can't speak to exactly the areas that our internal equity and inclusion group is currently working on, but that's where those kind of dashboards that I was mentioning, or the data, that's the really building out the ability to not just have data, but explore the data.
Exactly.
And we've even gone as far as to say it's probably not good enough that we have basic information on here. Let's add some statistics to it. Let's see if the trend that we're seeing, is it truly relevant to dive into and find some opportunities. And it's a partnership, right? Once you identify one of those areas, it's a partnership amongst many groups, including the clinicians that are in that space, equity and inclusion experts, the data folks who can sit side by side with them to ensure that the information that they're being provided helps them really build out the kind of answers to the questions that they're seeking. And, that's how we've been approaching it.
That's great. It sounds like you guys are taking a real holistic approach to this as well, too, which is great. You're gathering the data, but you're also engaging these other groups that touch the patient and touch the internal staff to make sure that you're in partnership with them and the type of information you're gathering and what they're wanting to understand in terms of what social determinants of health exist and how we impact that in a positive way. It's interesting, though, that many healthcare organizations aren't quite as evolved as you guys are. So I commend you for that. And they haven't made this kind of investment in data analytics and those supporting technologies and processes. So tell me, because it sounds like based on our conversation I know we've had in the past, you were at the kind of some of the early stages of the evolution of this as well within UNC Health. I'm just curious, how were you able to get UNC Health to start to look at this, invest in this, and make a commitment to continuing to grow this as a part of their business?
Yeah, no, that's a phenomenal question. And I am extremely pleased that it's not something that I've had to fight hard for. Our leaders are extremely data-driven, data-hungry. And that just leads us to so many wonderful places when we support them with information. So I would say that probably the biggest thing that our healthcare system gravitated towards was enabling our research community with data.
Right.
So in order for us to do better research, you have to have a robust data warehouse. Things can't live in individual silos and managed separately to be able to paint the kind of picture that you want to paint with the information that you've got.
Right.
That was one of the big investments that drove the initial stages of our data warehouse. I would say the implementation of our EHR back in 2014 was another huge shift for how we invested in data and analytics. And then the third area was a recognition of a lot of health systems. We were growing. We've gone from being 1 or 2 hospitals to quickly being 10 hospitals and now nearly 20 hospitals.
Wow, phenomenal growth.
It's a lot. And in short periods of time. And that comes with a lot more data and information that needs to be managed.
Exactly.
And so I think because our leaders are very data driven, they want to be aware of what's going on across our different orgs to ensure that the entities are supported and that the people and processes within each of those groups have the information they need to lead successfully.
Yeah.
But COVID was honestly a game changer. Right?
Oh, sure. It changed a lot of our lives. So many different ways. Yes.
And I think the one thing you saw even across health system was the sharing of information that this is what we've created for our groups. And I think that sharing of dashboards and the kind of data that groups were doing really helped our data-driven leaders to challenge us to do more.
Right.
And it really created an embrace for data science as well, for AI and how all that plays a part in helping them prepare for the future. And it's been a really compelling journey to continue to keep that momentum going and to continue to help our leaders get better insights all the time. And I think we're on a great track because of all of that.
No, that sounds great. If we can say one benefit that came out of COVID is our recognition of the value of data now, right? And all aspects of that, whether it's research data, surveillance data, internal data about patients, operational data, we recognize that there's a real value there as well. Just a couple more questions. We talked before, time flies when you are talking to great people like yourself, and we'll be wrapping this up shortly here. I'm just curious about your career. You talked a little bit about your journey in this space and how it didn't start out necessarily in this role today, but you touched on the clinical side for a while, and then you found your passion here in data analytics. For those individuals who are interested in careers in data informatics and or aspire to move into executive leadership roles, become the next vice president of enterprise analytics for their organizations, what words of wisdom and advice can you share or lessons learned through your journey to where you are today?
Yeah, so I love talking to folks about career because I find it so fascinating how all of us have gotten to where we are today or are planning to be tomorrow. My greatest advice, so I tell this to all whenever I do like school type things, but I have a personal motto that I live by, and it's really helped me along the way, but it's have courage, be kind, and stay curious.
Oh, I like that.
And living by that really helped me to see that there are times where I did not check every box. I was applying for a job or I was looking for new areas, but I followed my passions, things, and I stayed open to it.
Exactly.
I might have started on the business administration side of healthcare, and that's where my degrees were in.
Sure.
I really gravitated towards data and analytics. And
right.
That's where I found that I felt like I could add the best value to my organization and felt the greatest personal fulfillment. So my advice would be stay open to that, stay open to looking for the things that really drive you. We're at work how many hours of our day?
Right. Yeah. Good portion of our lives. Exactly.
Yeah. You might as well love it.
Absolutely. And I think it's also interesting in that a lot of times people want to take the direct route to a career objective. And I don't think life is meant that way. It's definitely a scenic route. And sometimes we are really trying to discover what our passions are, right? We may think we want to do something in one area initially, and we find that there may be some value there, but it's not my passion. And over time, you start to discover what that passion actually really is. And so the fact that you described your journey as one that didn't initially start in really the clinical side, but the business side, and now has gravitated towards the clinical side is a great example of how life takes you through a lot of different twists and turns. But also, quite honestly, how you can leverage those experiences and apply those experiences to what you're doing today. Just one final question for you, and I'm just curious, and you touched on it a little bit before, but maybe you can expound a little bit more on it as well, too. You see, this topic of discussion is around data analytics, AI, machine learning, and how you're leveraging that today. Can you offer a little more specifics behind some of the tools and technologies your organization's using today to aggregate that information and share it with the customers that you serve?
Yeah, sure. There are different aspects of data and analytics that start all the way from our source systems and how we extract that information. bring it into our centralized data warehouse. So there's a lot of organizations that debate the merits of a data lake house or a data warehouse, and some versions sometimes of all of those.
Exactly.
We have one enterprise data warehouse today, but we are like a lot of those organizations. We're talking about, do we expand our footprint in the cloud? Do we consider maybe creating a lake house environment that then feeds a more curated data warehouse? And the one thing about the data and analytics technology, and I think it took me going back to do my certificate program and talking to a lot of experts to embrace this, is that the technology in the data and analytics space evolves just about every 2 to 3 years.
Exactly.
So just when you think you got it,
right,
something new can come out.
Absolutely.
It does.
And I think that's the exciting part of it too. So it's an ever evolving industry as well too, and practice. And as technology evolves, our application of it evolves, and hopefully the benefit that it brings to the populations that we serve will evolve and improve as well too. And I think we're at the top of the hour, and I could probably sit here and talk another hour with you about a number of different things you're doing there at UNC Health. But I just want to thank you so much for coming on and joining me as a guest. I'm so excited to have you on, and I wish you much success in your career and the work that you're doing there at UNC Health. Any final thoughts you'd like to share with our audience?
Yeah. First of all, thank you, Christopher, for having me on today. And as a final thought, I would say that healthcare is a fun place to be for folks that are in data and analytics. It is one of the most fulfilling careers you can have. I know that there's a lot of great opportunities with those big tech companies and other spaces. But in how many jobs can you say that the AI or the dashboard or the data you created actually saved a life? So I would encourage those amazing talent, those amazing folks out there that haven't thought about healthcare to consider a career in healthcare, because it's a great place to be.
Absolutely. Absolutely. That's it, folks. We're at the end of this episode of Straight Outta Health IT. Thank you again for joining me, Rachini Moosavi, Vice President of Enterprise Analytics at UNC Health, for joining me on the program. Thank you for your insights, your leadership, and your example of servant leadership as well, too. We're so excited to see what you're doing and look forward to following your career and the work that's happening there at UNC Health. As always, thank you, everyone, for taking time out your busy schedules to join in and listen to this program. I appreciate each and every one of you. Please share this podcast with your friends and associates. Let's make this one go viral. I know it will. It's great insight and great feedback that I think everyone would appreciate too. So take care. See you next time, and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.